Welcome to LEMP Pharmacy Tutorial. Today, we will be looking at drug delivery systems.
You know, it's something we all take for granted, isn't it? You get a headache, you swallow a small tablet, and somehow it knows to go to your head. How? How does that tiny pill navigate the chaos of your digestive system and bloodstream to find its exact target? It feels a bit like magic, but I promise you, it's pure science.
The secret is something called a drug delivery system. The best way to think about it is like a super smart GPS for your medicine. A drug on its own is just a passenger. The delivery system is the vehicle, the map, and the driver all rolled into one, designed to overcome all the body's roadblocks to get that medicine exactly where it needs to be, when it needs to be there.
So here's our roadmap for today. We're going to take a journey through the main delivery routes. We'll start with the most direct path, injections. Then we'll explore how we can use the air we breathe, and even our skin. And we'll finish up by looking at some truly futuristic smart drugs. Sound good? Let's dive in.
Right, our first stop is parenteral systems. Now, that's just a fancy term for any drug that doesn't go through your gut. So we're talking about injections. This is the VIP entrance for drugs, a direct, fast-track route into the body. But because you're bypassing all the body's natural security checks, the standards for these drugs are incredibly high.
For anything that gets injected, there are 3 golden rules, the 3 non-negotiable pillars of safety. First, it has to be sterile. Absolutely no living germs. 0. Second, it must be pyrogen-free, meaning no leftover bits of dead bacteria that could trigger a fever. And third, it has to be particulate-free. We don't want any tiny specks of dust or glass floating around and blocking up blood vessels. These aren't just guidelines, they are absolute laws.
So how can we be sure a product is sterile? Well, there are 2 main ways we test for it. The first is called direct inoculation. You literally take a sample of the drug and pop it into a nutrient-rich soup. Then you wait. If anything grows after 2 weeks, the entire batch is thrown out. For larger amounts of liquid, we use membrane filtration. The liquid is passed through a filter so fine it catches any stray microbes. And then we test the filter itself.
Okay, so no living bugs. We're clear on that. But what about the ghosts they leave behind? Even after bacteria are killed, fragments of their cell walls, called endotoxins, can remain. And if these get injected, they can cause a massive fever. So how do we hunt for these invisible troublemakers?
For years, we relied on the rabbit pyrogen test, which is exactly what it sounds like. But the modern standard is something amazing called the LAL test. It uses an extract from the blood of the horseshoe crab, which, by the way, is blue, that clots instantly in the presence of those bacterial endotoxins. It's incredibly sensitive and has largely replaced the need for animal testing for this purpose.
The last big safety check for injections is something called tonicity. It's all about balance. Our blood has a specific concentration. An injection needs to match that. If a solution is too watery, hypotonic, water floods into our red blood cells, causing them to swell up and burst. Not good. If it's too concentrated, hypertonic, it sucks the water out of our cells, making them shrivel up. So the solution must be isotonic, just right, to be safe.
Now, after all that, you might be thinking, why bother with injections at all? Well, the payoff is huge. You get an incredibly fast response, and you know exactly how much drug is getting into the system because you're skipping the whole digestive tract in the liver. It's essential for emergencies or for patients who can't swallow. But, and it's a big but, there's no turning back. Once it's in, it's in. It can be painful, requires a trained professional, and of course, comes with higher risks and costs.
All right, moving on from needles, let's talk about something we all do about 20,000 times a day, breathing. The lungs are an amazing gateway to the body. They have a huge surface area and a rich blood supply, making them perfect for getting medication right where it's needed for lung conditions or even for rapid absorption into the rest of the body.
So let's break down the main devices you'll see. You've got your classic metered-dose inhaler, or MDI, the little puffer that uses a propellant. The trick is timing it right. Then there's the dry powder inhaler, or DPI, which is much simpler because it's activated by your own breath. Newer on the scene is the soft mist inhaler, which releases a slow-moving cloud that's really easy to breathe in. And finally, the nebulizer, which turns liquid medicine into a constant mist, perfect for small children or during a severe attack.
Now listen up, because this is absolutely critical. With these devices, especially the classic MDI, your technique is everything. It's not just a quick puff and go. You have to shake it well. Breathe out completely. Then, as you start to breathe in slowly, you press the canister. That timing is key. Then you hold your breath for 10 seconds. If you get it wrong, most of that precious medicine just ends up hitting the back of your throat.
Right. Let's shift focus. We've gone in through a needle. We've gone in through the lungs. What about just putting something on the body? This is where topical and transdermal routes come in. We're talking about applying medication to the skin or to mucous membranes like the eyes, either for a local effect, like a cream, or to get it into the whole body.
The eye is incredibly delicate territory. You can't just throw anything in there. So eye drops have a strict set of rules, a bit like injections. They must be sterile for obvious reasons. You don't want to cause an eye infection. The pH has to be balanced to match your tears, otherwise it'll sting. And you'll often find they're a little bit thicker than water. That increased viscosity helps the drop hang around on the eye for longer, giving the drug more time to work.
Now for one of the cleverest surface routes around, the transdermal patch. And no, it's not just a fancy plaster. It's a highly engineered little system designed to send a drug on a journey through the layers of your skin and directly into your bloodstream, providing a slow, steady dose over hours or even days.
So why would you pick a patch over a pill? Well, it solves a lot of problems. First off, just like an injection, it completely dodges the liver's first pass effect, so you get a more predictable dose. More importantly, it delivers the drug at a really constant, steady rate, no more peaks and valleys. This means you can often use a patch that lasts for days, which is much easier than remembering to take pills multiple times a day.
And this, my friends, is where things get really smart. We're moving into the world of modified release. This is all about pharmaceutical engineering, designing the pill or capsule itself to control exactly when, where, and how fast the drug gets released once it's inside your body. It's about making drugs work smarter, not harder.
You've probably seen the letters on medicine boxes. DR, ER, XL, CR. What do they mean? Well, delayed release is like a time bomb. It's coded to survive the harsh acid of the stomach and only go off in the intestines. Extended release is like a slow drip coffee maker, releasing the drug gradually over a full day, so you only need one dose. And controlled release is even more precise, like cruise control for your medicine, keeping the drug level in your blood perfectly constant.
Now, check this out. This is one of the most brilliant pieces of microengineering you'll ever find in a pill. It's called the Oro system. When you swallow it, water from your body seeps in through a special membrane. This makes a push layer swell up, and that swelling acts like a tiny piston, smoothly forcing the medicine out of a minuscule, laser-drilled hole at a perfectly constant rate all day long. It's literally a tiny pump inside a pill. Absolutely ingenious.
Okay, I need everyone to listen very carefully now. This is probably the single most important safety warning in this entire tutorial. Because of all this incredible technology we've just talked about, you should never, ever crush or chew a modified release tablet. Doing that destroys the entire system. You get the whole 24-hour dose in one massive instant hit. It's called dose dumping, and it can be incredibly dangerous, even fatal.
So where is all this heading? Well, welcome to the world of nanoparticles. Things like liposomes and niosomes are microscopic delivery vehicles. You can think of them as tiny, smart bombs. We can load them with a powerful drug, and they'll travel through the body, delivering their payload directly to a target, like a cancer cell, while leaving healthy cells alone. This is the future, a massive step towards truly personalized medicine.
Whew. Okay, we have covered a ton of ground, from simple injections to microscopic smart bombs. So let's take a breath and pull it all together. Because the bottom line is this: choosing the right delivery system is a massive part of modern medicine. It's all about matching the path to the patient and the purpose.
Remember our map from the beginning? Let's quickly recap. The parenteral route, our injections, is rapid and direct. The oral route is convenient, but it has to battle the first pass effect. The pulmonary route offers a fast track via the lungs, and the transdermal route gives us that slow, steady, continuous effect. Each one has a unique advantage, a special tool in the toolbox for doctors and pharmacists.
So if you remember nothing else from today, please remember these 5 points. 1. Injections must be sterile, pyrogen-free, and isotonic. No exceptions. 2. With inhalers, technique is everything. 3. Patches are great for steady drug levels because they bypass the liver. 4. Modified release pills make life easier and safer. And 5, and I'll say it one last time, never crush or chew a sustained release tablet.
And that really brings us to our final thought. A drug molecule, sitting in a bottle, is just a chemical. It's often useless on its own. It's the delivery system, the patch, the pump, the inhaler, the nanoparticle that transforms it. So think about that. How does choosing the right vehicle, the right path, transform a simple chemical compound into a life-saving therapy? That right there is the power and the beauty of this science.
Next episode, we will be talking about medication administration. Be sure to join in.